How to properly assess the blood pressure of an individual by Mason Morales. Prior to the assessment, a few requirements have to be met in order to ensure accurate readings. Begin by making sure the patient has had at least 5 minutes of rest, and consumption of caffeine or nicotine prior to the assessment is prohibited. Also make sure to acquire the proper cuff size. This can be checked by assuring the index line falls within the white range arrows on the cuff itself. Proper positioning. Make sure the feet are flat on the ground and uncrossed, the back is straight up and supported, and the arm is supported as well, palm up at heart level. It is critical to ensure that the reading be taken on a bare arm. Assessment. Begin by locating the brachial artery mark, which is indicated by a white arrow on the cuff itself. Next, palpate the inside of the arm to find the brachial artery. You will align the artery with the arrow mentioned before. Make sure the valve is turned all the way to the right. Next, ensure the stethoscope prongs are facing forward. Tap the diaphragm to make sure it is working correctly, and place it over the brachial artery. Inflate the cuff to 180 millimeters of mercury. Turn the valve to the left and release at a rate of 2 to 5 millimeters of mercury per second. The first thumping sound you hear is the systolic blood pressure. The last one you'll be hearing is the diastolic. These thumping sounds are also known as Korotkoff sounds. The systolic blood pressure is the highest pressure during contraction of the heart. The diastolic blood pressure is the pressure in the arteries between heartbeats when the heart muscles are resting and refilling with blood. After taking the blood pressure readings, this chart can help to identify what category the individual falls within.